Welcome back, Kevin.
Yep, here we are again.
Well, what Medicare Minute information are you going to share with us today?
Well, I'm glad you asked because there's three main enrollment periods. The very first one is probably the most important one. In a perfect world, like I said, kind of on the other podcast, everybody, when they turn the first day of the month they're born and turn 65, they go on Medicare, they're collecting Social Security, you automatically get it. And then you enter what they call the initial enrollment period. So 3 months before you turn 65, month of you turn 65, and 3 months after, you're in what they call the initial enrollment period, which happens one time after you start Part B. What that means is if you have A and B in place, remember, A is inpatient, B is outpatient. When you have Part B in place, it triggers the initial enrollment period, which means you can get any plan you want guaranteed. That's important because like we had mentioned in the last episode, if you get a Part C, a Medicare Advantage, everything's covered right away. No health questions, none of that stuff. But if you want to get a gap plan, which they call a Medigap, that means your A and your B is your primary coverage. A gap, like a Plan N or a Plan G, covers pretty much everything A and B doesn't cover. So that's an underwritten plan, though. So when you're in the initial enrollment period, you're guaranteed to get whatever you want. So that's important. If a person has health challenges or they might not be able to pass underwriting and get an underwritten policy later on, that's something to really consider because they can lock in their insurability for that type of plan.
Oh,
Yeah.
okay. So after that, do you have to keep doing the underwriting every year
No, once you have a Medigap in place, if you keep it, you're good to go.
forever?
Right.
Oh,
As
interesting.
long as you keep the plan. So you have your A and B, whatever A and B doesn't cover goes through your Medigap plan. Now the Medigap plan does have a monthly premium, but the neat thing about that is, although you're paying a monthly premium, there are no networks. You can go anywhere you want as long as you accept
Mm.
Medicare. Uh, and again, you don't have to have referrals. You don't have to have a primary care doctor. Most people do, but you don't have to. You're not locked in. And probably the most important part is it's a policy that you can get without having health questions asked. Now, if you wait, let's say you decide to go with a Part C first, Medicare Advantage, and you don't like it, then later on you want to try to get a Medigap plan, you have to qualify based on underwriting. And if you can't, based on your health, you can't get it. So sometimes I feel like I beat that point into the ground, but it's very important.
Yes, it is.
I mean, you got to have the budget for it, of course, but your insurability, locking in your insurability if you have health challenges is so big during the initial enrollment period. So that is a 7 month period, 3 months before, month of, 3 months after you turn 65. The other very important one is, and I'm going to save the one we're in right now for last. The other important one is what they call special enrollment period. That's for people throughout the year that might have a chronic condition like a heart condition or diabetes. If they have one of those things, they can look at plans more than once a year, like once a quarter, and they can change if they want to. They don't have to just wait to the annual enrollment period, which we're going to talk about next. That's when right now. So another special enrollment period is if a person has dual eligibility. They're on Medicaid and
Mm.
Medicare. Again, you have at least 3 or 4 times throughout the year that you can change plans with that. If you move, if you have a life change, they stop the plan or whatever the case may be, it opens up special enrollment periods throughout the year.
That's a good question. Is Medicare one of those things that's state specific
Not Medicare, but plans, yes.
plans? So if you
Right.
were to move out, then you would need to.
Yeah,
Yeah, I
exactly.
got you.
Yeah, I had a client.
And does Medigap follow
Yes,
you? Okay,
and that's
okay,
an advantage there
okay.
because the Medigap you can use anywhere. Again, as long as anybody accepts Medicare, you can get wherever you want. Now, if you get a Medicare Advantage and it's a PPO and it has a national network, same thing. You can use it in different places. But if a person moves most of the times out of the area or out of state, we can open up a special enrollment and they can look at something else. So they don't have to worry about they're stuck without anything. And then the last one, which is what we're currently in, is what they call the annual enrollment period. So if anybody's been on Medicare for any length of time, they'll know this time of year is the annual enrollment, not only because they've been on Medicare for a while, but because they're going to start getting calls from everybody.
Oh yeah, it's on every single thing
Oh
everywhere.
yeah, and and it's very tempting this time of year during the annual enrollment period to get tempted to call the TV commercials, to pick
Mm.
up the phone for a number you don't understand, to call a letter you get through the mail, to look at an email, text, whatever. It's and this it's unfortunate because there's a lot of scammers out there that prey on people on Medicare, and this time of year all they care about is commission.
Mm.
So they're going to try to change. They're going to try to tell you whatever you need to hear. Again, I had my event today, and one of the things I emphasize is I still do face to face. I mean, we can meet wherever. We can meet at the summit, the Chamber of Commerce. I have a shared office in Arlington. We can meet at your house. We can meet at the coffee shop, but face to face. So you can not only ask, but you can see all the information. But during the annual enrollment period, it's October 15th through December 7th. That's the time of year where people, if they're, well, they can make Medicare changes in any plan they have, but most people make changes with Medicare Advantage Part D. If they're on traditional Medicare, they can go to a Medicare Advantage and vice versa. Year to year, plans do change a lot.
Mm.
So whether or not you plan on changing, it's not like a set it and forget it type of plan. It's every year. If that's the only time you review it, you should, because carriers change plans, carriers drop plans, they add plans, they change benefits, they change networks. So don't just assume your doctors are going to be in the network again next year. Out of pocket cost for your specialist or inpatient stay might change.
Mm.
Was talking to a guy at my event today, and he said that he had Humana last year. Well, Humana no longer had a Baylor Scott White in their network, so he moved to United Healthcare because he liked he liked Baylor Scott White. So that's just an example of
Mm.
you need to look every year. Also, the prescription part changes. Is your prescription still the same tier? Is it even on the formulary anymore? A primary care doctor might accept more than one carrier, and so they can stay your primary care doctor no matter where you are. But their physician network might change, which
Mm.
means maybe your I don't know, your specialists aren't in there anymore. So this time of year, we can look at 2026 plans. We can review. We can compare. You can change if you want. You don't have to. And if you decide to stay where you are, it just can auto renewal. Last year, a couple of the carriers eliminated plans, so of course we had to put people in other plans. But I would highly suggest getting in touch with me to do a free consultation. Whether or not you change, we can build a relationship, and I will look up your doctors, your prescriptions. I'll look up everything, and you'll know that you have a solid plan after that. So, annual enrollment period October 15th to December 7th, but after October 1st, we can actually start talking about 2026 plans. We can't make any changes till after the 15th, but I have several appointments between now and the 15th to discuss things. And then if they pick one, of course, we can do it after the 15th. A lot of the times I'll wait to make points after the 15th just so we can not only meet, but if they want to change, we can take care of it at the same time.
Very good.
So yeah, important time of year. And again, I can't stress enough, whether or not you plan on changing, you definitely need to do a review. There's no doubt about it.
Well, I will make sure, just as always, that all of your information is in the post and in all the descriptions, so people can know how to find you, or they might see you when you're working out, because you do
Yes.
work out at the summit.
Yeah, so I go to the summit, and again, I have different events there, and also at the chamber I'm doing throughout the year, and then I also work at a ton of senior independent living facilities, and I started doing assisted living now. I got 3 of those lined up this year, from Flower Mound to Plano. So I work wherever people want me to come.
Mm-hmm. Well, good. Thanks again, Kevin. This is
Yes.
very informative.